Hi friends, welcome back to Coffee with Ravi. Today my post is about diverticulosis. This is a common word that gastroenterologists use. This is a finding that we see when we do colonoscopies that we explain to patients. Diverticulosis are sac-like protrusions from the colon wall. As you recall from previous posts or from common knowledge, the colon is like a tube that snakes all the way across the belly. Think about diverticulosis as pockets that sit on top of this tube, or sac-like protrusions that are off this tube. I have a photograph here. That's like a cross section of that colon wall. What happens in the colon is that there are several blood vessels, in actually 4 spots, 2 at the bottom where you can see it marked in red, and 2 at the top where blood vessels come into the colon lining from the outside. It's along these weak spots that these sac-like protrusions develop. You can see that in this colonoscopy photograph, where you can see this Swiss cheese type of hole in the colon, and actually if you look carefully you can see a blood vessel that is those blood vessels that I was pointing out that are running through this pocket. The reason these pockets develop is that the colon tends to act under pressure because it's pumping the stool contents out, and as it pumps like this, along these weak spots where these blood vessels come in, the inner lining tends to herniate outside. So that's kind of the essence of what diverticulosis is. Diverticulosis can happen because of, in general, as a society, we are not eating as much fiber. That, in combination with some people being prone to it, these pockets develop. A great majority of us actually have it as we grow older. Why is diverticulosis of concern? Because of these 4 complications. There are 4 things that can happen. Number 1 is bleeding. About 5 to 15% of people who have diverticulosis can develop bleeding. The bleeding can develop, and you can see in this colon photograph the blood that's pouring out. And if bleeding happens, you can see it. This is not a little amount of blood; it's a lot of blood that can come out, and one needs to seek immediate attention. The second thing that can happen in diverticulosis is that those pockets, because they're so thin-walled, can get infected. That also happens in about 5 to 15% of people who have diverticulosis. If this happens, people develop pain, mostly on the left side. It can be associated with fever. The pain can last a few days, and sometimes if the pocket ruptures, it can form pus pockets in the belly, or it can form a communication between the colon and other organs that are surrounding it, such as the urinary bladder, etc. So that's diverticulitis. I have a photograph here that will show you from the inside what that diverticulitis looks like. So in other words, diverticulitis is infection or inflammation of the pocket, whereas diverticulosis is just the description of the pocket itself. The third thing that can happen is that you can get colitis that's associated with diverticulosis. In other words, because of the way that muscle in that area works or decreased blood supply, that segment of the colon can get inflamed. Lastly, there can be just symptoms from diverticulosis because of the muscle spasm in that area. So people get some pain or discomfort, and that's not diverticulitis, but it's a symptomatic, uncomplicated diverticular disease. How can we avoid this? Number 1, by increasing dietary fiber. Decreasing red meat consumption, as well as increasing physical activity and avoiding smoking, all seem to help both in preventing diverticulosis as well as preventing the complications of diverticulosis, such as bleeding and infection. Lastly, having less gut fat and avoiding medications such as non-steroidal medications such as ibuprofen, naproxen, Aleve, etc. are helpful. Steroidal medications sometimes kick up the risk of complications, as well as opiate medications, which we sometimes use for pain control. So these are things to avoid. And in general, the common themes for all of our aspects of posts that we're covering is that this kind of lifestyle modification, where we're eating more of a plant-based diet, more of physical activity, less of gut fat, all of these seem to play in many ways in improving gut health. So thank you, and I will see you next week.